Your doctor has mentioned mastoidectomy, surgery for long-standing ear disease that hasn't cleared with medicines alone. The mastoid is the bony bump behind your ear. It contains tiny air-filled spaces that connect to the middle ear. When chronic infection, or a cholesteatoma, an abnormal skin growth, spreads into the mastoid, it can erode bone. Surgeons commonly recommend mastoidectomy for cholesteatoma, ongoing discharge, or infection that has not settled with drops and antibiotics. Before surgery, doctors use a hearing test and CT scan of the temporal bone to map the disease and nearby structures. The operation is done under general anesthesia. An incision behind the ear lets the surgeon reach the mastoid bone. Using a microscope and high-speed drill, the surgeon opens the mastoid air cells and carefully removes all diseased tissue. Key structures nearby, the facial nerve, inner ear, and brain lining, are identified and protected throughout surgery. If the eardrum has a hole or the hearing bones are damaged, the surgeon may repair them during the same operation. Most adults go home the same day or after one night. Some pain, muffled hearing, and mild dizziness are normal early on. For the first weeks, the ear must stay dry. Heavy lifting, straining, and swimming are usually restricted while healing. Healing of the eardrum and settling of hearing can take 2 to 3 months. A follow-up hearing test measures the new baseline. Risks include changes in hearing, temporary dizziness, taste changes, and rarely facial nerve weakness, discussed carefully before surgery. For many people, resolving years of ear discharge and infection brings real relief and a clear improvement in daily quality of life. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.